A revolutionary new technology has the potential to change the medical industry as we know it. Needle vision is a patented imaging technology that allows the clinician to see forwards of the needle tip.
The idea behind needle vision was to be able to see through the needle to its very tip, to see what's at the far end. So that you have instantaneous information about where your needle tip is and that you are trying to avoid any vital critical structures.
As we advance needles into different parts of the body, having ultrasound technology is very beneficial. One of the limitations that remains with conventional ultrasound technology is something called a blind spot.
You cannot see forwards in the center of the needle.
And at times, we do lose our ability to define exactly where our needle tip is underneath the skin.
So we found a way to overcome this blind spot. It's called VARS, Variable Angle Reflecting Surface.
The patented technology is made by sound waves that are bounced off a rotating disc at variable angles. In sequence, these reflections create a forward-looking image.
So that one can advance the needle as desired into the proper direction.
Epidurals. For millions of women around the world, getting an epidural is a routine part of delivery.
I regret having the epidural because I went home after 3 days with probably the worst headache I have ever had in my life. It's really bad, it's sort of indescribable. I had to crawl to the bathroom. Had it been done right, I didn't have to have the pain. It would have been nice if I didn't have that, because it ruined the beginning week of going home and trying to enjoy my child. I wanted to stand up. That was impossible. I couldn't stand up.
We accidentally do puncture into structures that we would have preferred not to puncture to.
Since you don't have a guidance system in the traditional way, it sometimes takes many passes with the needle until you find the tunnel which leads you to the epidural space. The technology that Dr. Raphael developed would allow you to see that epidural space.
This potential complication can likely be avoided completely and dramatically increase the satisfaction of many patients throughout the world.
Here at California Lasers, we built the prototype needle with the grant from NIH. We're basically utilizing technology from today versus technology from 20 years ago to improve products, make better things.
These images taken with a needle vision prototype show how even delicate structures are visible, so fine that even the layers of the eye can be recognized.
It will rapidly replace the current technology in terms of performing ultrasound-guided procedures for nerve blocks, biopsies, and targeted therapies.
For those who require plastic surgery, such as those who have suffered breast cancer, needle vision would be invaluable.
After breast cancer reconstruction, this fluid is surrounding an expander or an implant used for the reconstruction, and if I go in even a millimeter too deep, I puncture the implant or expander and it's damaged, and that patient now needs an additional unnecessary surgery to replace that device. I don't have the luxury of holding an ultrasound probe with one hand while manipulating the needle with the other, so if I had the visualization on the needle itself, that would be very beneficial to me.
Anytime one does a biopsy, nerve blocks, vascular access, all of those things can be significantly enhanced by having an ultrasound transducer at the tip of the needle, as well as being able to avoid serious and very costly complications.
Cost would not be a particular issue there because those are essentially life-saving procedures.
Needle vision, seeing forward today.